Good morning. Today I'm going to talk about the EPIPEN auto-injector uses, indications, contraindications, and some of the complications. First of all, we need to know that EPIPEN or epinephrine is the most important medication to be used in management of anaphylaxis and anaphylactic shock. And the auto-injector, the EPIPEN auto-injector, contains this medicine, which is the epinephrine, and it is available in three concentrations, which are pre-dosed, the 0.1 milligram and the 0.15 milligram and the 0.3 milligram, and these doses are used according to the patient weight. So infants who are less than 10 kg, they are using the 0.1 milligram, and for 10 to 25 kilogram, the auto-injector that's prescribed for them is a 0.15 milligram, and children who are above 25, they can use the 0.3 milligram. The auto-injector doses can be repeated 2 times, and they can be given 5 to 15 minutes apart according to the persistence of the symptoms of the anaphylaxis. Epinephrine is the best available treatment for management of anaphylaxis, and it should be used once a severe allergic reaction is suspected or anaphylaxis is suspected. So you need to know what are the signs, some of the signs and symptoms of anaphylaxis that require the use of epinephrine. Like if the person is complaining of severe skin rash, or if there is feeling tightness in the throat, or feeling lightheaded, or they think they might pass out, or breathing difficulty, or if they are experiencing abdominal symptoms like vomiting, diarrhea, or abdominal pain, or they have hypotension, low blood pressure once they are exposed to a known allergen. Now, how do we use the EPIPEN? We'll demonstrate now for you how to use the EPIPEN auto-injector. So it comes in a case like this. You open the case and you take out the auto-injector. The auto-injector has 2 sides, the blue side and the orange side, where the needle is. The blue side is called the safety release, so you need to pull it off and you face it to the sky. And you hold the auto-injector in this way, so you wrap your palm around it and you hold it in this way. And the orange side, where the needle is facing the thigh. So blue to the sky and orange to the thigh. And the location that you can inject the auto-injector in is in the mid-lateral part of the thigh, and you can inject directly over clothing. So you hold the auto-injector, you swing it, and then you hold it firmly and to the thigh, the mid outer part, and you hold it there for 3 seconds. So you count 1, 2, and 3. And then you take it out, and once it's taken out, the orange side will cover the needle, so you won't be able to see the needle. And then you can rub or massage the area for around 10 seconds, and after that the person who's experiencing the anaphylactic reaction should be taken immediately to the emergency department. Now, regarding the contraindications for using the EPIPEN or the epinephrine, there are no absolute contraindications for using this medication, because as we said, it's a life-saving medication in the cases of severe allergic reaction. So once you suspect an allergic reaction, or the patient is known to have a severe reaction, allergic reaction, and exposed to an allergen, you should immediately use the EPIPEN. Now, the thing regarding the complications or the adverse effects that can result from using the epinephrine, there can be a mild transient and common reactions or adverse effects like palpitation, anxiety, restlessness, tremor, and headache. And these are mild and transient and would resolve immediately. The other uncommon and more severe adverse effects, they more common to be to develop in patients with cardiovascular diseases or patients who are on stimulant medications, and these are mainly cardiovascular effects like ventricular arrhythmias or myocardial infarctions or angina. And even though if these patients, they require the epinephrine to treat an anaphylactic shock, this shouldn't prevent you from using the EPIPEN. And the third one is the unintentional injury that can develop if you are not using or following the instructions for the proper use of the EPIPEN, like intentional injuries to the finger or to the thumb from if you are holding the EPIPEN inappropriately. And final thing about the adverse effects, most commonly they would result if the EPIPEN was given through the IV route rather than the intramuscular route, or if the larger doses are used inappropriately. Thank you for listening, and I hope it was useful.